us about all what we senior citizens should really know about nephrology and connected kidney issues.
Good afternoon, everyone. And good morning, everyone. I'm Dr. Yogesh. I'm a consultant nephrologist here, and thank you for giving me this opportunity. So, basically, I would limit my talk to lesser time and be more interactive. Would like to take more questions from you rather than me talking more. So, basically, the presentation is about chronic kidney disease. At the outset, I want to tell you that there are two kinds of kidney disease. Whenever a kidney disease comes to your mind, one is acute kidney disease and second is this chronic kidney disease. So acute is basically when something has happened in hours to days. For example, if I was well 48 hours before and I had severe diarrhea, right, as a result of which, or I had severe pneumonia, as a result of which my creatinine went up, right, and that will be categorized as acute kidney disease. Chronic kidney disease is when the disease has been present in your body for more than 3 months. Okay, so that is the very outset. So today I will be dealing with chronic kidney disease. So first, basic about kidneys. So there are two organs, there are two kidneys in your body. They are about the size of your fist, around 150 grams, located at your back. Basically, it's the rib cage that you have is just right below rib cage. Okay. Now, the function of the kidney is divided basically into three parts. One is excretory function. That's the most common thing that we think of as a layman when we think about kidney. That it is the excretory organ of our body. It excretes the waste that is generated by metabolism in the body. But the components that we don't realize also that kidney also does is endocrine function. See, your hemoglobin is normal because there is a hormone named erythropoietin which is produced by the kidney. Why these things are important? Because then only you know that the symptoms which you have when your kidneys are not working properly. So one of the important function, endocrine function, is to produce blood. Blood is generally produced by bone marrow, but the hormone to produce it is produced by the kidney, erythropoietin. That is why in the patients with kidney disease, as the stage progresses, you will have anemia. Second is vitamin D. Now we normally feel that when we sit in sun, we generate vitamin D, but that is the inactive form of vitamin D. Vitamin D becomes activated by hydroxylation in the kidneys. That is active vitamin D, 125 dihydroxyvitamin D. So the active form of vitamin D is generated in kidney. So whenever we have kidney disease, our bones also get affected. Another important thing is salt and electrolytes balance. Particularly salt I would like to stress, because salt we can take through diet, but the way the salt is excreted is through kidney. So if your kidneys are not functioning properly, your salt will not be excreted in urine properly, as a result of which it will start to build up and you will have that swelling in your bodies, or your blood pressure will start to go up. Control of blood pressure, one of the mechanism by which kidney controls blood pressure is to this salt control, salt excretion. Second is another endocrine function known as renin. So when there is a blood supply to the kidney decreases, and there is a hormone which increases in the body, which leads to hypertension, especially in old age. See, whenever you have onset of hypertension, for the first time you are diagnosed with hypertension in a patient who is less than 30 years of age or in a patient more than 60 years of age, we think of secondary hypertension. That means there has to be a cause of it. We do try to find out a cause of it. So in a patient who is more than 60 years of age and for the first time he has been diagnosed as hypertension, kidney is also an important cause of that. How bad is the kidney disease? What is the prevalence of the kidney disease? Around 850 million people have some form of kidney disease in the world. In India, 1 in every 10 people are having some form of kidney disease, which translates into approximately 130 million people. It has now become 8th most common cause of death in India, and with the rate at which it is progressing, it is going to become almost 5th common cause of death in India. Now, what are the risk factors for kidney disease? Practically speaking, almost 50 to 60% of the patients that we see in OPD because of kidney disease are of diabetes and hypertension. So these two are the most prevalent causes of the kidney disease in our OPD in India and worldwide. Besides these two, there are other rare forms of kidney disease that constitute almost around 30-40%. Glomerulonephritis, stone, genetic disease, urological problem, and one more thing what I wanted to stress was over-the-counter medication drugs. We commonly go to the pharma shop and ask them for painkillers, for gas medicine, for Ayurvedic medications and all. So prolonged consumption of these medications do affect your kidneys in a bad way. The problem is there is not very clear-cut early signs of the kidney disease. It's very generalized. For example, if you have a heart problem, you will have some chest pain, or you will have some chest heaviness, or difficulty in breathing. In kidney, generally these symptoms are not very prominent. So, for example, in a patient with diabetes, right, how do you know that your kidneys are getting affected? So the earliest marker in most patients is you start to leak albumin in urine. Okay, and when it goes beyond what we call as severely increased albuminuria, then you have this swelling in the feet and around eyes. So there are many causes of swelling in the feet and eyes. I mean, if you have heart problem, if you have liver problem, you can have swelling in your feet, but swelling around your eyes, this is an early indicator that you are losing protein in urine. The non-specific symptoms such as fatigue, poor sleep, sexual dysfunction, decreased appetite, bone pain, nocturia. At your age group, you can have prostate enlargement, which can lead to, nocturia means when you wake up more than 1 or 2 times at night. But in kidney disease, that's also an early sign of the kidney disease. In a young patient, if he is waking up more than 2 times at night, he should also be evaluated for the kidney disease. And this point I have already told you about onset of hypertension below 30 years and after 60 years of age. And as kidney disease advances, you will have low hemoglobin, you have difficulty in breathing, you will have nausea, vomiting. 2 important things that I want you to remember when you go out of this call is creatinine and eGFR and urine protein and urine albumin creatinine test. So basically I have taken an example. So for example, a 60-year-old male comes, 60-year-old male with a history of long-standing diabetes and hypertension. He comes with a creatinine of 1.8. Now for that lab, let's say the normal value of creatinine was 1.2. So you would feel that it's only 1.8, so it's mildly, increased creatinine. But always convert creatinine or ask your doctor, or you can do it yourself on Google by converting creatinine into GFR. GFR is the most important thing. Creatinine will always mislead you. GFR will always tell you the exact status of the kidney. So 1.2 was the normal value of the creatinine in that lab. His creatinine was 1.8 at the time of presentation. 3 months back it was 1.6. So when we convert into the GFR, then we realize the problem. So even at 1.6 creatinine, which he was having 3 months back, his GFR was only 49 ml per minute. Now, before I go into this, I should tell you about what is GFR. GFR is basically functioning of the kidney in the layman language. So normally what happens up till 40 years of age, your kidney functions around 100%, and that is 100 ml per minute. Now, once you go beyond 40, with every passing year, your kidney functions 1% less. So, for example, let's say at 80 years. At 80 years, your normal kidney function would be 60 ml per minute. That would be physiological to your age, right? Now, at 60 years, what would have been his normal kidney functioning? 40 minus 20. As I said, after 40 years, 1 ml per minute will decline. So, at 60 years, it would be around 80. But when he got his creatinine test 3 months back, only 49% of his kidneys were functioning. So almost around 30% of the kidneys were already gone. It was 1.8. That means in 3 months, his kidney declined from 49 to 43. So you can realize by converting creatinine into GFR how grave the problem is. If you go by creatinine, it will always mislead you because see 1.2 to 1.5, it's not a big deal, 0.3 only. But when you convert into GFR, you will realize the significance. Another important test that I want you to remember is routine urine and urine albumin creatinine ratio. See, we all know about routine urine. It's a urine test that we generally ask to do for a first void morning sample. The first urine that you pass in morning, we ask you to give it for sampling. The problem with routine urine is, in the routine urine you have you must have seen it, albumin or protein, right? It's negative, trace, 1 plus, 2 plus, 3 plus, 4 plus. The routine urine actually detects when your albumin excretion is beyond 300 milligram per dl, what we call a severely increased albuminuria. That means the disease is already set in when you see routine urine albumin in your routine urine, right? So it's always better to do urine albumin creatinine ratio, UACR. That is also done in the first void morning sample because it detects albumin below 300 milligram per dl. So it detects albumin between 30 to 300. Normal excretion of albumin in a person is less than 30 milligram per day. So 30 to 300 is what we call as moderately increased albuminuria. So that's the time to catch patients because once it goes beyond 300, then the disease has already set in, right? So always remember these two things. Creatinine, convert it into GFR. Routine urine, don't go by routine urine alone, especially if you have comorbidities as in diabetes, hypertension. Always ask for urine albumin creatinine ratio as well. You know why it is important? I want you to focus on this chart. This is a heat map chart by KDIGO, which is our organization, worldwide organization, which sets guidelines. Now, so this is one thing which I want to focus on. Normally, as I told you, the normal GFR. So it's based upon two things. One is GFR, no, and this is albumin excretion. Now, basically, there are 5 stages of kidney failure. When your GFR is more than 90, then it is stage 1. Stage 2, when your GFR is 60 to 89. Stage 3 is divided into 2 parts, 3A, 3B, 45 to 59, 3B is 30 to 44. Stage 4, when your kidney functioning is between 15 to 29. And stage 5 CKD is when your kidney functioning is less than 15%. Now look at this thing. This is a heat map. So this is red, this is orange, this is yellow, this is green. Now, for example, a person comes to you with a normal GFR, for example, his GFR is between 60, so you will tell that the disease is not severe. But if he is leaking albumin in urine, then he again comes into that category of as bad as moderately to severely increased GFR. So, what we do, what we see normally is this part is ignored. So always look for albumin also, right? So that will give you an idea, because this heat map tells you about risk of both cardiovascular disease as well as the risk of progression of kidney disease. So prevention basically, see, both luckily diabetes and hypertension, both has to be prolonged and absolutely uncontrolled to involve kidneys. The problem with both of them is both of these diseases they are silent killers. I mean, you don't know that you are having diabetes or hypertension. I mean, by the time you present, for example, if you are having this common thing is that you will have headache when you will have hypertension. There are many patients that we have seen in the OPD that they are not compliant to the blood pressure medication. They say that when we have headache, we feel that our blood pressure is high, we take our medication, then we stop. But understand that it's not always that you will have headache, right? So measurement of blood pressure is very important. So control of hypertension, I would also like to add measurement of blood pressure. See, previously we used to have mercury-based blood pressure instrument. Now we have aneroid-based blood pressure instrument. Now, 2 important things that I want to add here is, previously we used to have this concept that when a patient comes to our clinic or hospital, we used to measure the blood pressure, give the medication as per that. But what we have realized over a period of time is white coat hypertension. Whenever you come to hospital, you have that anxiety with you, right? You are walking, you have that anxiety with you, I'm going to meet a doctor. So the blood pressure that you measure in hospital is not always the correct one, right? And you come to hospital in say once in a month or once in a 3 month. So that's not going to give you an idea how your blood pressure is affecting your body when, for example, 29 days when you were at home. So now the concept has changed from blood pressure monitoring at hospital to home blood pressure measurement, and another thing is 24-hour ambulatory blood pressure measurement. That is why we encourage the patients to take blood pressure in an environment in which they are most of the time, right? So that will give you an idea how good or bad the blood pressure are. Another important concept is masked hypertension. In very few patients, when they visit hospital, their blood pressure is normal, right? But again, that is masked hypertension. They must be having hypertension at home, but when they have come to us, I measure the blood pressure, it was normal, so I told you your blood pressure is fine. But again, the disease is progressing. So that is why this home blood pressure monitoring is extremely important nowadays. That is a lifestyle disease. So you have to do lifestyle modifications such as healthy diet, salt intake. Salt intake is very important. What we call as less than 4 grams of salt. How do you measure that you are taking 4 grams of salt? Because in a family the food is made as a whole. I mean, किसी के लिए अलग बनता नहीं है. So how do you quantify it? So what we tell in a patient who has uncontrolled hypertension, कि इनका खाना आप अलग से बना लो, and you have that cough syrup bottle with cough syrup cap with you. वहाँ पे लिखा रहता है 5, 10, 15. So try to fill it just below 5. So that will give you an exact idea that I am taking 4 grams of salt. So आपका खाना बिना नमक के बनेगा और वो आप कैप उसको दे दो, पेशेंट को दे दो. In 24 hours you take only that much amount of salt. So your food would be prepared without any salt, but you will be allowed to take this much of salt in next 24 hours. So that will actually quantify your salt intake. Potassium rich diet, actually say dry fruits, coconut water, banana. These are not for kidney patients, I'm talking about general. So in them, potassium-rich diet is helpful in reducing blood pressure. Smoking has to be stopped. Alcohol intake has to be decreased. It should be less than 2 drinks per day. Weight loss, with every kg of weight loss, your blood pressure decreases by 1 mmHg. And obviously exercise. Try to do brisk walk at least 5 days a week. Diabetic, how to prevent kidney disease in diabetic? Control of diabetes is the most important thing. Whether you are requiring insulin for that, whether you are requiring 3 or 4 medication for that, your HbA1c and fasting sugar has to be controlled. And it's recommended by WHO that every diabetic, every year and annually should have a kidney function test, routine urine and urine albumin creatinine ratio done. And over-the-counter medication has to be available. Coming to what happens when your kidney fails. So then we talk about this dialysis and transplant. Generally we don't do dialysis till the GFR is less than 15. When your kidney functioning is less than 15%, right? And in a CKD patient, right, the dialysis has to be permanent. It initially starts with 2 times a week and then it goes up to 3 times a week. There are 2 kinds of dialysis. One which is done at hospital, what we call as hemodialysis, and second is peritoneal dialysis that you can do at home. It's a dialysis done through your abdomen. Kidney transplant is always better than dialysis because dialysis actually does only one part of the kidney function. It does only the excretory part of the kidney functioning. It does not produce any hormone. It does not control your blood pressure. So transplant is always better than dialysis in both terms, quantity of life as well as quality of life. And there are 2 kinds of kidney transplant. One is living donor transplant that someone from your family will donate, or cadaveric transplant that you have to register in a hospital, where if a patient dies and he is placed for organ donation, then you will get his organs. So take home point is control your blood pressure and diabetes, avoid counter medication use. Remember these 2 terms, eGFR, urine albumin creatinine ratio. In a patient who is at high risk, get it done every 3 to 6 months. Healthy diet and exercise. Always better to come to nephrologist at a right period of time because when the GFR falls below 20, there is hardly any drug that we can use for preventing the progression of kidney disease. Then it becomes symptomatic treatment. You are having fluid, extra fluid in your body, and you use medication to remove fluid in your body. I mean, we don't have medication beyond less than 20 GFR that will retard the progression of the kidney disease. So it's always better to meet nephrologist at the earlier stage of the CKD. So,
thank you, doctor. Can we start with some questions?
yes, sir, please, sir.
Is that kidney has to do with something that a person at the age of 80 or 85 is so much tired that he is simply not able to get up and do anything in the activities of his normal, which about a year or 2 back he was able to really do it. Is that the 2 things which you can tell what?
So, sir, first question, that his creatinine was normal, but he was leaking protein in urine, right? That is why we stress upon urine albumin creatinine ratio. See, you imagine kidney like a chai chhanni, right? Chai chhanni में चाय पत्ती और चाय जब हम लोग डालते हैं तो चाय पत्ती वहीं रह जाती है, चाय छन के नीचे आ जाती है। अभी उस चाय छन्नी में छेद होनी शुरू हो जाए तो क्या होता है, चाय पत्ती भी नीचे आने लगती है। जब बहुत सारे छेद हो जाते हैं तो यू डिस्कार्ड द छन्नी, राइट? Same with kidneys. Kidneys has almost 1 million glomeruli chhanni in your right and left kidney. So 2 million glomeruli as a whole. The earliest stage in most of the disease is leakage of protein in urine, right? So that is why what I see in OPD and in general practice is most of the patients are worried about their creatinine, right? My creatinine has jumped. But they don't worry about the albumin. I mean, the creatinine is a byproduct of your albumin. Because you are leaking too much of albumin in urine or too much of protein in urine, one day your creatinine will be affected. So be more concerned about albumin. So in your case, sir, the gentleman which you were talking about, he was leaking albumin in protein. So there has to be a cause of it, right? It can be just because of diabetes or hypertension, or third cause which I told you, glomerulonephritis. There are many diseases in which the glomeruli are affected, right? And then they will leak protein in urine. They require generally kidney biopsy. If they don't have any diabetes or hypertension, we generally do kidney biopsy to find out what is the cause of leakage of protein in urine. But to emphasize that creatinine always rises late. You know, there is a staging that you will start to first leak albumin, which can only be detected in the urine albumin creatinine ratio. From there, you progress to severely increased albuminuria, and then you will start to have swelling in your feet and around eyes, and then your creatinine will start to increase. By the time the creatinine starts to increase, your 30 to 40% of the kidneys are already gone. So that is extremely important than routine urine and urine albumin creatinine ratio. It tells you at a very early stage your kidneys are getting affected. You need to intervene, right? First, so these are the question to just to answer your first question. Second question, beside these tests, beside these functioning, kidney has a very important role in sodium handling. So there are many times I've been asked question that how much of water a normal person should take, right? Because if you take more of water, then also it's harmful. If you take less of water, then it's also harmful. Now, in a person who has no comorbidities, no heart issues, no liver issues, no kidney issues, in order to maintain your healthy kidney, we call it as 8 is right. I mean 8 glasses of water, which translates into around 3 liters of water per day in males and 2.2 liters of water per day in female is an adequate amount of water. Beyond this, if you have thirst, you can take it. But if you're taking 3 liters of water in males and 2.2 liters of water in female, that's okay. Now, what happens if you take too much of water? Right? Too much of water, for example, in a say marathon runner, right, who is sweating a lot. So the problem between sweat, the difference between sweat and water is when you sweat, you lose both water and salt. But when you take water, it's a pure water. There is no electrolytes in it. So a marathon runner is running too much and he's losing too much of salt, but he's taking only plain water. So what has happened is that you are losing salt and water and you are taking only water. Then this will affect your sodium. Now your sodium will decrease. Similarly, when, for example, in old age, example, a person is having Alzheimer's disease or dementia and he's not able to take water, enough of water, then the sodium will increase. In those cases, even your kidneys are normal, but it's because of the imbalance by the kidneys, you will have that symptom that you were telling, that he's drowsy, he's weak, the sodium handling by kidney also plays a role in such symptom if your kidney function is normal.
Should he, instead of taking pure water, he should start taking some electrolyte type thing, which you can suggest? What is a natural substitute to electrolyte instead of using a powdered type of electrolyte? Is that
Coconut water.
Nibu
Coconut water
pani?
is best.
Coconut.
Coconut water. That's as close to plasma as you can get. Normal plasma that we are having in blood. So, but if you take normal water, normal food, your electrolyte will be normal. Now we have so much of hormone in our body that if you know the values of electrolytes, sodium, it's exactly maintained between 135 to 145. Potassium between 3.5 to 5. But there's so much of hormonal things going on in our body that they keep them in extremely well checked manner. I mean, there has to be a big problem when these are altered. So body is an amazing thing. I mean,
KFD, sorry. At that time, I think they are only checking creatinine. They are not checking what you said, all those ratios.
Basically GFR is an equation. So that's what I'm telling. You can so GFR is an equation which takes into account 3 things: age, sex, and creatinine. Now it can either be given by the lab. You can request your lab to give a GFR equation also, or you can calculate it by yourself on Google.
But in our annual routine checkup,
It should be added.
most of us are healthy and going on, and they simply go by that whatever creatinine disease.
That's what I'm telling, sir. Creatinine will always mislead you, sir. You should always ask the lab to give you GFR as well. And it's a simple.
That would go over and above what?
No, sir. It's just an equation. I mean, they can calculate. I don't think they would charge you extra for just calculating GFR. I mean, it's a calculator. You put in value, and they will give you GFR.
We can ask
Yes.
GFR's result also
Yes,
along with that.
always. Anyone is having comorbidities, any kind of comorbidities, heart, hypertension, diabetes, always ask them to add urine albumin creatinine ratio as well. So these 2 things that will always tell you that your kidneys are dysfunctional at a very early stage so that you can intervene. Many patients take combi flame when they have headache, and even the gas medication, what we call as PPIs, pantoprazole, omeprazole. Now, there are lots of studies which tell that consumption of these medicines for weeks and months is not at all good. Not at all good. I mean, it causes acute kidney injury, chronic kidney disease, dementia, COPD. So, this is one of the most abused drugs which I see.
This acidity problem and gas
You
problem.
can change it to another class of drugs, famotidine or Rantac. You must have heard about
Rantac.
This is not as strong as PPIs,
That's okay.
but it is far less toxic than PPIs.
What is PPIs?
Pantoprazole,
pantoprazole.
omeprazole, all the azoles that you see.
Okay, so you suggest that it's better to take Rantac family?
Always.
Always, okay.
If you have gas problem first, that is forcing you to take Pantocid throughout your lifetime, you should meet a gastroenterologist because it's not advisable that you take Pantocids. I mean, it's a medicine after all. There has to be a cause of your gastritis, right? If you have some problems such as GERD, reflux disease, right, then you take it for 2 to 3 weeks, stop it, and then go into Rantac or less toxic drug than PPIs.
Dr. Rantac, is it related to cancer in any way?
Yes, sir. I mean, there are data which are suggesting, but again, if you compare the toxicity of these two drugs,
Right.
Rantac is far less toxic compared to azoles. And see, even if you have gastritis, for example, if I have gastritis, take the drug for 2 weeks and then stop it.
Right.
Beyond 2 weeks, if you are going, there has to be a reason for that. You meet your gastroenterologist.
Yes.
वैसे तो डॉक्टर्स जब कोई एंटीबायोटिक्स या स्ट्रॉन्ग मेडिसिन के लिखते हैं तो वो पेंटोसिड तो पहले लिखते हैं
2 वीक
मॉर्निंग में
एंटीबायोटिक जनरली ओरल एंटीबायोटिक का कोर्स 5 से 7 दिन का होता है जनरली, अगर आईवी एंटीबायोटिक होता है तो
स्ट्रेस बिकॉज ऑफ स्ट्रेस उनको ये
SIADH कहते हैं मैम, अब मेरे को सारा डिटेल्स नहीं पता, बट स्ट्रेस से जो सोडियम कम होता है उसको SIADH कहते हैं, सिंड्रोम ऑफ इनएप्रोप्रिएट एंटीडायरेटिक हार्मोन सिंथेसिस। जब स्ट्रेस होता है तो एक हार्मोन का सिंथेसिस ज्यादा हो जाता है बॉडी में, उसको ADH कहते हैं, उसके वजह से भी टेम्पररी आपको हाइपोनेट्रीमिया मिल सकता है, सोडियम कम मिल सकता है।
Just you can put the value in Google also, but
Yeah,
you can also have.
there's an equation known as CKD EPI 2021 equation. That's the latest equation that we follow, and generally the labs that we also see gives GFR by that equation only. So you can Google it also. It's just an equation. You need to put 3 values, age, sex, and creatinine, and they will give you a value of GFR.
Thank you, Yogesh. Dr. Yogesh has really able to deliver on this subject of such an important function of our body. And I would request my colleagues to once again give a clap. And I will request Yogesh, please accept our token of appreciation for your support. Miss, I will request Mrs. Mathur, who is, don't get up. Yogesh can accept it like that. Thank you. Thank you very much. Thank you very much.